Welcome to this session on Introduction to Pediatric Care. By the end of this lesson, you will be able to 1. Define pediatric care and explain its role in nursing and midwifery practice. 2. Differentiate pediatric patients from adult patients using clear physiological and clinical examples. 3. Identify the major pediatric age groups and explain how they influence care. Let's begin with the first concept. What is pediatric care? Pediatric care refers to the branch of healthcare focused on the health and well-being of infants, children, and adolescents from birth until adulthood. It includes prevention of illness, diagnosis and treatment of diseases, monitoring growth and development, providing vaccinations, supporting nutrition, and guiding families in maintaining a child's health. In simple terms, pediatric care involves ensuring that children grow, develop, and recover from illness safely. However, caring for children requires a specialized approach because children's bodies are constantly changing as they grow. Unlike adults, children are still developing physically, mentally, and emotionally. Their organs are still maturing. Their immune systems are developing, and their ability to communicate symptoms may be limited. Because of this, clinicians must interpret signs of illness differently and often rely on behavioral cues and caregiver observations. For example, a child who suddenly becomes unusually quiet, refuses feeding, or breathes faster than normal may be showing early signs of serious illness, even if the symptoms appear mild. Keep in mind that understanding pediatric care allows healthcare providers to recognize these early warning signs and intervene before the child's condition worsens. Now, let's take a look at what makes children clinically different from adults. Children differ from adults in many important physiological and developmental ways. These differences affect how diseases appear, how rapidly illness progresses, and how treatment must be given. Children have higher metabolic rates, which means their bodies use oxygen and energy more quickly. Because of this, breathing problems can lead to oxygen shortage faster than in adults. Their airways are also smaller and more flexible. Even a small amount of swelling caused by infection or allergy can significantly narrow the airway, making breathing difficult. Another important difference is the way children respond to illness. Children often maintain normal blood pressure even when they are very sick because their bodies compensate by increasing heart rate and tightening blood vessels. This means serious illness may not be obvious immediately. However, once these compensatory mechanisms fail, deterioration can occur rapidly. This is why subtle signs such as fast breathing, poor feeding, irritability, or unusual sleepiness should never be ignored. Medication processing also differs in children because their liver and kidneys are still developing. Drugs may be absorbed and eliminated differently. For safety, most medications are calculated according to body weight. You should note that recognizing these physiological differences helps clinicians provide safer and more effective pediatric care. Now, let's take a look at how do pediatric age groups affect clinical care. Pediatric medicine divides childhood into developmental stages. Each stage has unique physiological characteristics, health risks, and communication needs. The developmental stages includes A. The neonatal stage. B. Infant stage. C. Toddler stage. D. Preschool and school-age children. And E. Adolescence. First, let's take a look at the neonatal stage. This includes the first 28 days of life. During this period, newborns are adapting to life outside the womb and are vulnerable to infection, temperature instability, and feeding problems. Next, let's take a look at infant stage. Infants grow rapidly during the first year of life. Their immune systems are still developing, making them susceptible to infections. Nutrition and immunization are particularly important during this stage. Now let's take a look at toddler stage. Toddlers begin exploring their environment actively. While this promotes development, it also increases the risk of injuries such as choking, poisoning, and falls. Next, let's take a look at preschool and school-age children. They develop stronger communication and reasoning skills. This allows healthcare providers to interact more directly with the child, while still involving caregivers. Last, let's take a look at adolescence. Adolescents experience major physical and emotional changes associated with puberty. Care at this stage must respect privacy, autonomy, and mental health considerations. We have come to the end of this session. Before we end this session, let's quickly recap the main points. Pediatric care focuses on children's health. Children are different from adults because they are still developing. They have unique physiological differences and medication needs. Pediatric age groups include newborns, infants, toddlers, children, and adolescents. Each age group needs different care. Thanks for watching. See you in the next session. Bye for now.